I wanna I wanna know what's the hesitation here? Are we shy or are we do we just know patient doesn't need it? Anybody? Liana? Marianne? You can unmute yourself and are we asking for whitening to the patients?
I would mention it like if they're interested or are they worried about like how their teeth look, but most of the time
Okay.
they'd be like,
They're
you
okay
know,
with it?
yeah.
Okay. What about irrigation? Are we mentioning it when the patient comes in for perio maintenances?
Irrigation during the first visit with SRP, yes, I would. And some of them would say yes.
Great.
The
Yeah.
rest of them would re-eval, I would do it. But I've only seen like two, three re-evals so far. Because as I mentioned before, they were being scheduled on doctor's side.
Okay. So if you see revals on the doctor side, you can ask the front office to schedule it with you. Or if
Okay.
you have opening at the same time, just move it over on your side because I want hygienists to do the reeval. So we can spend time with the patient, we can do the probing, and if patient needs the rest, and we're able to do it.
Okay.
Okay, and that goes with all the hygienists, Jessica, Denise, Leanne. Appointments. Are we making our own hygiene appointments? Everyone. You guys can unmute yourself and let me know.
I've been making my own appointments.
Yeah. Okay. Great. Um,
Yes.
Thank you. There is an uptake on patient retention, recall retention, so it's working. So thank you for scheduling the recall appointments by yourself. It's doing what we intended to do. So thank you. Please keep making those recall appointments. Um, so you would notice some of the patients, you would see you need to do prophy on these patients, and that's what's attached. But it's important to look back into the history of those patients and see if there was an SRP done and we attached prophy by mistake. Okay, so I think we caught a couple of patients last time when I was there in River Park with Jessica. So it's important to look at patient's history and see what this patient had done before. And then if the patient had SRPs done, then the prophy is attached, then change it to perio maintenance.
Are they perio maintenance? It's every 3 months with Denti-Cal, correct?
Correct.
Correct. And then you keep calling. You don't alternate between perio maintenance and prophy. They're all perio maintenance. Is
They're
that
all
correct?
perio maintenance. That's correct.
As far as irrigation, I just include it. I don't really give them much of an option. Like
That's great.
this is part of the treat.
Thank you.
I just and that I don't get much pushback.
That's amazing. Yeah, it should be included anyways.
Usually it's not what you say, it's how you say it. When you talk, I've
The
learned
verbiage.
if you talk with authority, it comes across that way.
Yeah, exactly. Thank you, Leanne, for bringing it up. So please include those irrigation with perio maintenances. And I'm glad you talked about a perio maintenance every 3 months. I wanted to bring it up. SRPs with Denti-Cal is covered every 24 months. So if which is why I request all of you guys to look at the SRP history, look at the perio maintenance history. If the patient had done SRP and it's been more than 24 months, let the doctor know. And then it needs to be re-diagnosed and we have to send the authorization for SRPs. Okay, so please make note for yourself to mention it and to look at the SRP history. Probing needs to be done every 6 months. I hope you guys are doing it, and I'll monitor. Hygiene doctor handoff, is that happening? Are we letting the doctor know that this patient is here for period maintenance, and these are the findings? How are we doing in that area? Denise, Jessica, anybody? You guys can unmute.
Oh, sorry. This is Sheila. I signed it
Hi, Sheila.
late.
No problem. Thanks for joining.
Mhm. So I missed your question.
Yeah, sorry. So I'm talking about doctor handoff. So are we discussing the findings with the doctor, what the patient needs, and the SRP histories, stuff like that? How how
Yes,
how is that going?
I always do that. When I open the chart, I check the X-rays
Mm-hmm.
and my notes are my biggest tool.
Okay.
Then I know from that yeah. But our doctors are really good with the diagnosing the deep cleaning
Yeah, that's good.
and Encino.
Great stuff. So, I really want, a hygiene doctor handoff in the operatory when the patient is there. It's kind of a good gesture. It shows professionalism, and patient can hear it. So, it works. It works really well. So,
I have
yeah.
in River Park when you only have 40 minutes with the patient, it's kind of hard. I never
Sure.
really have the chance to do that. So
Okay.
I move them to the next room and then doctor comes in. So I'm already on to my next patient. So it kind of gets lost, especially in that office and also at Prairie. But every other office, it's fine.
Great, no problem, Jessica. If that's the case, what I would do is I would relate to the patient, let the patient know, hey, I've discussed the findings with the doctor. He's gonna come in just a couple minutes and go over some of the things that we talked about. So that way, the handoff is done, right? And then let the doctor know, or let the system know, or make a note of it of some of the things that you've found, so the doctor can discuss.
Yeah, I normally do that. I
Right?
just put a little note.
Beautiful.
Do exams need to be done every time, or is it, well, if you do a 3-month perio recall, do you have to have an exam every time?
Dr. Puri would like the patient to meet the doctors if they're there and if there's a time. But insurance wise, exams are every 6 months.
Okay.
Yeah. Um, and yeah, so that was doctor handoff, and I also wanted to bring front office handoff, right? So I'm glad we are scheduling those recall appointments by ourselves, and that way, the patient can just go if there is no copay that needs to be collected at the front. But if patient has pending treatments, that needs to be told to the front office that, hey, so and so patient has something pending. Could you please talk to the patient? I think the patient's interested, and get that schedule. So that still needs to happen if there is anything pending and you think the patient's going to schedule. Okay. So that's what I'm talking about with the front handoff. So make sure that's happening. Specialty referral. I see, sometimes Leanna, and the other hygienists are scheduling patients with the perio. Great stuff. I like that. Make sure you fill out the specialty referral form, okay, which is usually at the front. We need to scan that in and we need to give it to the patient. Recall x-rays, we have a standard of taking recall x-rays every 6 months. So please take those x-rays. IOPICs, equally important to take every time the patient is there, especially if it's a Denti-Cal patients. Okay. I'm also seeing a lot of new patients that are scheduled under hygiene column. We have a standard protocol of giving all our new patients a quick tour of our staff, our doctors, do a quick introduction. Doesn't take long, really a quick minute, and then take those new patients into the operatory. I think it's a good gesture, and it's a great first impression that we give to our new patients, and it goes well. When it comes to the treatment planning and all that, we've seen a great treatment acceptance as well, right? So please do those new patient tours when possible. Um, Towels, equally important. Please, we want to create a spa-like environment. So please give those warm towels to the patient to relax after the appointment. So those are some of the points I wanted to bring up. And I think we are doing great when it comes to the recall appointment scheduling. Amazing. I brought up a couple of new points. SRPs, please keep an eye on SRP history, perio maintenance history. We need to make sure, we know the history of the patients that are coming in. Any things that you guys want to mention? I'll open the floor up for anybody who have any points. Okay, sounds good. Thank you all for joining, and we'll send the notes to your email, okay? We'll meet again next
Okay.
week. Thank you.
Thank you.
Thank you.
Yeah.
Bye-bye.